Imagine a world where you get access to health data just like that. Your next appointment, the results of your blood test, even the medication you need to be taking. Initially database for scheduling, electronic health records has since evolved, now supporting e-messaging, clinical decision-making, and health innovation exchange, all to improve the quality of care for patients. No wonder we've seen remarkable attempts to increase this global digitization. In 2002, the UK created the NHS Care Record Service, a national attempt to introduce century care systems. Across the pond, Obama passed the American Recovery and Reinvestment Act, providing incentives for healthcare stakeholders to adopt an electronic system. Though popular, the rate of adoption has still varied substantially, begging the question, are electronic health records feasible? Are they secure? And ultimately, are they money well spent? Today, we'll be hearing from both sides with Brent Schafer, the CEO of Cerner, a leading e-health provider, and Professor Lynn Coventry, thank you for being here, who wrote a scathing report on cybersecurity. Now, Brent, I'd like to start with you. I've got here you saying, and I quote, that empowering consumers is the right thing to do. So, in what way will digital records help deliver on this sort of idea?
EHRs inspire health promotion and patient competence, empowering them to make their own decisions. Let's look at Vine Health, an exciting startup which inspires cancer patients to manage both their symptoms and medication. E-records are undoubtedly going to revolutionize patient care.
Mr. Schafer, I agree. This system can be beneficial to patients, but is it actually beneficial for doctors? I mean, inspections have discovered multiple issues with uploading and transferring data to e-record systems. Poor document scans and disorganized files have all led to gaps in patient data, and they're just wasting precious time. EHRs have led to pajama time in America, with Medicare-compliant doctors spending their weekends documenting instead of relaxing. And that's not even the tip of the iceberg. An in-house expert tech team will be required. Is that something that your company is willing to fund?
Ms. Coventry, please, we've thought about all of this. You just can't ignore the convenience of healthcare staff to have instant access to records. Think about all the precious time wasted looking for files when they're misplaced on wards. Let's get this straight. The study found that 15% of 117 reports in a district general hospital were illegible.
Listen, this is just absolutely crazy.
Okay, look, I want to civilize a bit. Thank you very much. Moving forward, Professor, I've been reading your report, and you raised some interesting issues regarding the security of such electronic health records. Are electronic health records, not secure?
Okay, firstly, as CEO of Cerner, an electronic record provider, you're only focused on profit. How about you focus on patients for once? The 2017 WannaCry attack held patient information for ransom, costing up to £92 million. Is this also something that's covered by your insurance policy? Barnaby Jack, a New Zealand hacker, has previously shown that you can actually hack insulin pumps to deliver lethal doses to unsuspecting patients. Security flaws can also be exploited for a lot of reasons, from selling prescription drugs to cyber wars enacted by foreign governments. All of them undermine patient trust. They're not safe and they're not secure.
Privacy is important in healthcare too, but the solution is not to restrict access, especially when we are dealing with life and death decisions.
But it's privacy. You have to restrict it.
We have to move on. Thank you so much. Now, recently we had Jacob Haddad on the show, who is the CEO of Acurex, and he was saying that, I can quote that, healthcare is no longer a knowledge industry, but actually a communication industry. So in what way will EHR really help to improve communication?
Communicating digitally can help reduce delays in gathering necessary data for an effective diagnosis. In one study, remote monitoring in an intensive care unit reduced mortality while also reducing both average length of stay in the unit and related costs by about a third. It's better for the hospital, better for the physician, and ultimately better for the patient.
Look, these records are just not feasible, okay? As you mentioned before, the NHS Care Record system is just a complete failure. It took £12.7 billion for them to figure out that there was just a huge lack of interoperability in the system, which hasn't been solved ever since. In 2018 alone, there was 11 million occasions where hospitals were unable to access full patient records. Do you know how dangerous this is? Is this the kind of better patient-centered care that you're trying to sell?
Thank you. That is all the time we have for. Thank you, Mr. Schafer, and thank you, Professor Coventry, for being here. We have to move on, and now we would like to hear from those on the front line. Today we have, I believe, Dr. Zhu, is it? a junior doctor excited by the prospect of EHRs, and also Dr. Worthington, an experienced GP. Thank you for being here, who remains uncertain of some of the benefits. So, gentlemen, in what way will EHRs deliver on being patient-centered?
Look, Raja, EHR improves the quality of care for patients, and that's a fact. Using EHR allows for the tracking of at-risk individuals and encourages them to have a regular checkup. Dangerous conditions like cancer can now be detected early. Error messages can alert doctors of potential mistakes. Unbelievably, diagnostic errors cause roughly 40,000 to 80,000 deaths each year.
Dr. Zhu, have you heard of alert fatigue? This is a phenomenon whereby a doctor is exposed to so many risks that they become desensitized and ignore smaller risks, potentially putting patients at risk. Continuous use of EHR can lead to exactly this. The introduction of EHRs could also widen healthcare inequality, since those who don't have internet miss out on accessing their health records. Additionally, patients with varying levels of health literacy can lead to misinterpretation. We should instead fund the super determinants of health, looking at how the lack of broadband can directly correlate to poorer health outcomes.
Are you crazy? Are you suggesting we use budgets?
Thank you. There's one more question here, and that is, are EHRs cost effective?
That's an interesting question, Raja. EHR is certainly a long-time cost-effective solution. A cost-benefit analysis of EHR in primary care showed a return of investment of $86,400 per provider over 5 years. As mentioned by Brent, paper records can be easily misplaced. What happens then? Well, according to Eric Topol, this problem leads to over 10% of scans being repeated. Dr. Worthington, the money saved can be used to promote healthcare quality and the quality of care for all patients.
That could be true in theory, but Rome wasn't built in a day. In reality, EHRs, as well as training its users, has been notoriously costly. Just look at Australia in 2015. They launched a $485 million e-record platform, but only 33% of its healthcare workers were aware of its existence, and only 11% registered. Do you think money grows on trees? The over-reliance on technology can detract from the patient-doctor rapport as well. A 2017 report showed that for every hour of direct patient care, 2 hours were spent on EHR tasks. Active listening and responding empathetically alleviates stress and increases patient satisfaction. Dr. Zhu, our attention must be on the well-being of our patients, not some lifeless screen.
Okay, that is all the time we have for. Thank you so much. I understand we have a Dr. Asirami in the audience. What are your sort of thoughts?
Well, Roger, on one hand, EHRs can be cost effective, but it's important not to forget the serious cybersecurity concerns raised by Professor Coventry. Either way, there's a clear intention to digitize records moving forward, as highlighted in the WAPTA report and the 5-year forward plan. But before we continue, we need to understand why such implementations have failed in the past. Firstly, we need to address interoperability by considering needs on a local level, but most importantly, we need to engage our workforce. Only by ensuring that both doctors and nurses are aware they exist, know how to use them, and are convinced of the benefits, will we then see widespread adoption. And this is why Chief Clinical Information Officer networks are going to be so important going forward. Money well spent? I'd say so.
Well, there you have it. Our electronic health records, money well spent for organizations. We'd love to hear from you, so make sure to tweet us and use the hashtag eHealth to join in the conversation online. We're going to take a short break. When we're back, we'll be dissecting tonight's debate and getting everyone's reaction. Until then, take care.